Micah Ward. I'm interviewing you for my health professions class at Northern Kentucky University. I'll be asking you several questions on your experiences as a health professional, and do I have your consent to record this video?
Yes.
Before we jump into the questions, can you introduce yourself and your health profession?
Yes, my name is Rhonda Colvin. I'm a registered nurse. I've been a registered nurse since 2006.
Question number one, what sparked your interest in this health profession?
I've always been a people person. I started out doing hair. I did hair 12 years before I went into nursing. I wanted to really go into nursing right after high school, but I was afraid to go to college because I didn't do too well in high school. It was my fear of math.
Yeah.
I was very good in English. I was in advanced placement English. I was terrible at math, and you know, being in nursing, you have a lot of calculations that you had to do as far as drips. Thankfully, a lot of the things are computed for us now. And then I had instructors during college that actually worked with me and helped me get through that. But just my overall love for helping people, making a difference for people, with people, and it's also in my birth chart to be a caretaker. I'm a life path number 6, so it's my destiny to be a caretaker.
What do you wish you knew before entering the field?
What do I wish I knew before entering the field? It has changed a lot, and I'm not just going to say healthcare has changed a lot. Things have changed a lot. People don't respect healthcare professionals like they should. When I first started, it was a respected position. I just think that we're living in a climate and a culture now where, you know, people take people for granted. They don't understand that this job, you know, you deal with the family members, you deal with the doctors, and you pretty much are the middle man. And so you do get a lot of, you have to develop some thick skin to be in this profession. And it wouldn't have changed my decision to be a nurse, but it was a rude awakening. People think that it's a job where you don't do a lot of work. It's a mental, physical, and a spiritual thing that you deal with on a day-to-day basis.
Yep. Okay. And going from that, what trends are emerging in the field that students should be aware of?
Well, China is, they have, you know, AI is getting ready to take over a lot of jobs.
Yep.
So we have to be aware, we have to keep up with the technology, and also find out, to be honest if our jobs are going to be replaced by AI. Because a lot of jobs, you know, a robot can do, you know, and a human being is not necessary to do the job. So, you know, we have to keep that in mind, you know, there's a lot of research. We've come a long way with the technology. A lot of things that we're doing now. Back in the day, people they wouldn't even be alive. So we have come a long way with the technology. I just wish that there would be a way for us to work alongside of the technology and not be replaced, because at the end of the day, you can put a robot at the bedside, but you'll never get, that human interaction. Would you even want a robot taking care of you? Wouldn't you want somebody that has feelings and emotions to take care of you? Because you want somebody to be relatable when you're going through what you're going through. And not a robot, somebody that's just programmed to read from a script.
Okay. What is the most challenging part of your job, and what's the most rewarding?
The most challenging part, I would say, is, you are a human being at the end of the day, and that's on any job. They gave us a script that they want us to basically come into the room and introduce ourselves, and there's a line between being professional and being a human being and being personable. So, you just have to, you're dealing with all kind of personalities. You have to learn how to pretty much let a lot of things roll off your back, because you have patients there in situations where they're sick. You're the closest person to them, so they may take their anxiety and fears out on you, the family members as well. So you have to find you're human too. But at the end of the day, you have to try and be as, understanding, yes, and because that could be you in that situation. But the most rewarding thing is, just making a person feel at home, feeling comfortable in the environment, and making them feel like you're giving them your best. You're treating that person. Always, when I deal with patients, I treat people how I would want to be treated. I imagine, what if this was one of my family members here that I'm taking care of, and I try to, always make sure that I can give them the best care possible to make them feel comfortable, no matter who they are, because everybody deserves to be treated, with respect, dignity, and they deserve to be, treated, get fair treatment, regardless of socio-economic, political, religious, any of that. You set all that aside when you take care of people, and you take care of the person like you want to be taken care of. And I think that's the bottom line right there in healthcare. With anything, you treat people the way you want to be treated.
Yeah, we talked about that in the class recently this week, and we had a group discussion about that online and all that. The final question: what's a typical day in the life as a nurse?
Well, when you come in, you get your assignment, and you get report from the nurse that's leaving, that's going home, off going shift. You go and you introduce yourself to the patient, let them know that you're here, for 12 hours, and you have three, you have breakfast, lunch, and dinner. So A lot of people are diabetic, so you're given, we do vital signs at the beginning of the shift. Med passes start, you have an hour before, like you can pass them, if your meds are due at like 8 o'clock, you can get meds at 7 o'clock and 9 o'clock. After that, after 9 o'clock, they're considered late. Well, our unit is a 4-to-1 patient ratio, 1 nurse to 4 patients. But you know, of course, you can be short, you know, staffed, and then you have 5 patients.
Yeah.
So of course, you know, you still have the same amount of documentation to do. So between noon, 8 and noon, you try and really between 8 and 10, you want to have all your morning meds passed. And then we do vitals at noon, and then we do vitals again around 4 o'clock. So it's rough, you know. You really, it's not one of those jobs where they say, okay, you work 7 to 7. You may be at work till 8:30, 9 o'clock, depending on how your day went. Because you know, people are going out for tests, they're going out for procedures, which throws you out because you have to stop everything you're doing to get the patient onto the stretcher, send them off for their procedure. You might have to call report on that patient, like if they're going for surgery, so you have to call report. You might be in the room doing something at that time, but you have to stop everything you're doing to go do that. And then, you know, they tell us that we have a lunch, pass off your phone, which I don't want to pass off my phone to my nurses. They don't want to pass off to me because they don't want to, you know, that's a time for you to decompress and really, so you don't get the 45-minute lunch break. You don't. You take your phone with you to lunch. People are calling you, texting you while you're on your lunch break. And if you get a phone call, then you get up from lunch and you go take care of whatever you got to take care of. So your lunch, basically, you stuff in your mouth. You might sit down for 15 minutes just to get something in your system, and then you back out there. So it's constant. It's no sitting down, relaxing. When you leave for work, then you can relax. But from the time you get on that floor, it's go, 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 go.
So
at the end of the shift, I will give report to the night shift nurse because I work day shift, and I'll tell them, you know, everything about the patient, what went on with the patient that day, what tests they had, lab results, if they went for any procedures, what went on with the procedure. Just let them know what happened with the patient that day. That's what you do at the end of the shift.
Okay. So you said there's a 1 to 4 ratio. How do you balance out your patients and managing that?
You typically will see the sickest patient first. Like if you have a patient that's medically unstable, you're gonna see that person first because they're the priority. If everybody else vitals are stable, the patient in stable condition, you always want to address the person that's unstable first, and make sure that if whatever issues are going on, you contact the doctor so that you can prevent them from further deterioration. So that's the main thing you want to do. And then after that, I try and see my diabetic patients first, because you want to make sure that they get their insulin, if they need insulin when their meals come. And that's another hard thing because it used to be that everybody got their meals at the same time, but now they have it to where the patients can call down and order whenever they want to. So then, you know, you may be back and forth in the room, and then the people, the PCAs, to get the blood sugars, you know, it throws the whole thing off. So, you know, you just have to be flexible and go with the flow.
Thank you for your time and sitting down with me to do this interview for my class. I really appreciate you. You have a great day.
You too. Thank you.